Formula is packaged in several different ways: powder that is mixed with water, ready to feed, and concentrated liquid that is diluted with water. There are also several different types of formula. Formula is made from cow's milk, soy protein, or pre-digested protein. Formula made from pre-digested protein is called hydrolyzed formula. Soy-based formula and hydrolyzed formula are typically used when a baby is allergic to cow's milk. Ask your baby's doctor what type and brand are best for your baby. Do not give your baby anything but breast milk or the formula your baby's doctor recommends. Regular cow's milk, soy milk, or any other kind of milk is not sufficient to meet your baby's nutritional needs. Babies require all of the extra vitamins and minerals in breast milk and baby formula. Typically, babies do not start drinking cow's milk until they are at least 1 year old. Talk to your baby's doctor about the appropriate time to switch from formula to cow's milk. Many types of bottles and nipples can be used to feed your baby. Nipples are typically marked by age and rate of flow to help you determine which nipple to use. If the nipple opening is too small, your baby will have to work extra hard to get the milk out of the bottle. And if the nipple opening is too big, your baby can choke on a gush of formula. When you prepare a bottle, always wash your hands. Before you use bottles for the first time, wash all the parts, including the bottle itself, the collar, and the nipple. If you wash your bottles by hand, use hot water and dish soap. Use a bottle brush to clean the bottles and use a nipple brush to clean the nipples. Squeeze soapy water through the hole in the nipple. Then squeeze hot, clear water through the nipple several times. Rinse everything under hot, clear water. Let your bottles air dry on a clean towel or a bottle drying rack. If you wash your bottles through the hot cycle of a dishwasher, separate all of the parts, bottle, collar, and nipple, before placing them in the dishwasher. Always check the expiration date on the container before using it. Prepare formula according to the directions found on the container. Read the directions each time a new container is used to make sure the directions haven't changed. Formula that is overly concentrated can damage your baby's kidneys. Formula that is too diluted may not provide adequate nourishment. Never add a supplement to your baby's formula unless instructed by your baby's doctor. Formula or breast milk can be served cold, at room temperature, or warm, whichever your baby prefers. If you decide to heat the liquid, never use a microwave. Hot spots can exist that you cannot feel from touching the bottle or even from testing a few drops on your wrist. Your baby's mouth or throat can be burned. Instead, run the bottle under warm water or place it in a bowl of warm water. Once your bottle is prepared, shake a few drops on your wrist to ensure the temperature is acceptable. Find a relaxing, comfortable place to sit. Hold your baby in a semi-erect position. Your baby's head should be on the inside of your elbow and her bottom in your hand. Guide the nipple gently between your baby's lips and tilt the nipple so that it is always filled with formula. This prevents your baby from swallowing air, which can cause discomfort. Burp your baby halfway through the feeding and again at the end. Feeding is a great way to spend one-on-one time with your baby, helping the two of you bond. Quietly talk to and cuddle your baby. Never prop up a bottle or put your baby to bed with a bottle. Your baby could choke. Laying baby down with a bottle can also cause tooth decay and possibly ear infections. After you have finished your feeding, discard the remaining formula promptly. It is safe to prepare more than one, even up to a day's worth of bottles, but don't keep them in a refrigerator for more than 24 hours. Do not freeze formula.